We've been focusing a lot on the federal worker fallout, but there are other impactful services on the Trump administration's chopping block, and one of those is Medicaid. Just last night, the House narrowly passed a budget resolution that would offset major tax cuts, likely by slashing billions of dollars in Medicaid benefits. Jess Arnold is on top of this story, and she spoke with a Medicaid advocate, Jess, based right here in D.C. What did you learn that helps us unpack all of this?
Yeah, well, a lot of people are affected here in the district. About 40% of the population is on Medicaid, according to the D.C. government's February enrollment report. Now, when benefits are slashed, advocates say some of the first to go are usually vision and dental coverage, and that can have a ripple effect on all of us. I spoke with a dentist who serves mostly this population about the catastrophic impact he says these cuts could have on so many D.C. families.
You have to understand this is the lifeline of the city. These are sanitation workers. These are people answering the phone. These are in your grocery store. These are the people that are in security companies. These are construction workers. This also means that that small things such as a dental abscess or a filling will get neglected and will end up bigger issues. This also means that dental issues will end up in the emergency room, which is not the place to handle dental issues.
As we may remember from COVID times, more people heading to the emergency room means longer wait times. Dr. Coombs says this also means higher costs for the taxpayer in the long run because ER treatment, of course, is much more expensive than preventative care. Now, because of DC's unique relationship with the federal government, he points out that about 70% of Medicaid funding comes from the federal government. So these slashes could disproportionately affect DC. And this would be coming to an already strapped system. Dr. Coombs says fewer and fewer dentists are providing care to Medicaid users because they receive 30 to 40% less per service. So availability of this care is already a problem. And again, this impacts everyone.
You may not feel that you're impacted directly by it, but you are. Everything from getting a cup of coffee to getting groceries, there's most likely somebody who is able to provide that service for you because they do not have to worry about healthcare. And the moment they have to worry about healthcare, they'll either leave the city or be put in situations that are unfortunate. Crime will go through the roof. If you think crime is bad now in the district, imagine what happens if you need money just to get a tooth removed, right?
Now, when it comes to this budget plan, the next step is for the Senate to pass the same one to clear the way for the president to implement his policy priorities. Now, to be clear, it doesn't specifically say the cuts have to come from Medicaid, but committees will have to come up with billions of dollars in savings, and moderate Republicans and Democrats alike worry that the only place that really could come from is Medicaid. Annie?
Such a complex issue. Jess Arnold, thanks for giving us a little glimpse into that. Thank you.